Hi everyone. Today we'll be going through quite a complex lower right impacted wisdom tooth. So you can see the OPG here. From the OPG we can't really tell if the crown is buccally facing or lingually facing. So we took a cone beam. Also, there's a close relationship with the nerve. You can see the cone beam shows the crown is facing lingually. Now this confers additional difficulty. This is one of the cross sections from the cone beam. The reason I've got this one here is because it shows just how close the nerve runs to the crown of the tooth. We're obviously going to be sectioning the crown, but we've got to be really careful as we get deeper or towards the mesial aspect of this crown, because it's quite easy to damage the nerve in this area because of its location. So my flap is only has a distal relieving incision. This flap's gonna end up being a lot bigger than most of my flaps, and that's because the amount of buccal bone I've got to be removing in this case. So I started off going to about the midpoint of the 7, which is pretty typical of what I usually do. In this case, I knew that I'd be removing quite a bit of buccal bone because of the fact that that crown was facing lingually. Also, I really wanted very good visualization. When the nerve's running as close to the crown as it is in this case, there's a huge risk of nerve damage. So you need to make sure that everything's as clear as possible. I had one of my best assistants assisting for the procedure, keep everything nice and dry. So we start with some buccal removal. The tooth's completely impacted, so you can not really see any of it at all until we start the bone removal. So I'm just using a bone drilling burr. It's a tungsten carbide and a slow speed electric handpiece. Bone removal in this case is, we start on the buccal. I use, the flap is still pretty conservative, so I've got to manipulate it to be able to get to all areas without causing any soft tissue damage. So we're going ahead and doing that to start off with. So you can see the buccal gutter there. It's quite a generous one. We've probably got between 2 and 3 mils, and I'm extending that more mesially to expose more of the crown. So now's when I actually realised that the flap's probably a little too conservative. We bring it around to the midpoint of the 6, basically giving me much better visualization of that buccal area. We're going to be actually extending our bony window more mesially as well. So yeah, that's another reason we need the flap out of the way, I guess. So just raising that bit now. And because the flap's so large, the periosteal elevator is not going to cut it for this next bit. So we're going to pretty quickly get a Minnesota in there. And now we're extending the bony window further anteriorly. So for those of you who have watched my other videos, the key difference here is I'm being a lot less conservative with my flap, with the bone removal, and the big reason for this is simply because I've got less room for error for my section, like the actual section of the tooth, and also I need to deliver something that's facing lingually from the buccal, which means that you've got to have a lot more bone removal. So we start the process of sectioning the crown. Now the footage here isn't the best. The only angle of visualization is the angle that I'm actually looking at. So if we place the camera there, then obviously I won't be able to see. So I've skipped over a lot of the sectioning. But basically we're looking at creating an angle that doesn't have an undercut, so we can facilitate delivery of that mesial part of the crown quite easily. The hardest part of this bit is basically just making sure that I don't drop the burr into the bone where the nerve exists. So we deliver that mesial section fairly straightforward, but we find that there's still a little bit of the mesial crown on the lingual aspect of the tooth. Being careful not to obviously go too far lingual, because that's where the lingual nerve lies. We just do a little bit more sectioning to get that lingual bit patent, so it moves independently of the root complex. So here I'm using a root pick. Usually we use a Cryers for this bit, but it's quite deep down. The lingual bit of tooth will come out in a sec, but we managed to get rid of the actual root complex at the same time. And you can see that mesiolingual corner of tooth. And at this point it's pretty much a formality getting that tooth out. And this, we didn't go through suturing, but this is what it looks like. We ended up putting in 3 sutures, and these are the sections of the tooth. Thanks very much for watching. Please like, share or comment. Thank you.